Okay, so before I enter this patient's room, I'm gonna check for any droplet, airborne, or contact precautions on the door. I don't see anything for this specific patient, so I'm just gonna be practicing standard precautions. I'm gonna use gloves and hand hygiene. Okay. Hi, come in. Hi, my name's Ashley. I'm gonna be your nurse for today. Could you verify your first and last name and date of birth for me?
100 yes, April 28, 2000.
Okay, awesome. If I could just see your wristband. Okay, perfect. That information matches the one in my paperwork, so I'm gonna get started on my hand hygiene. Wash my hands for 20 seconds. I'm gonna don some gloves. Okay. So, do you have any allergies that I should be aware of?
No.
Okay, this is gonna take about 15 to 20 minutes, so do you need to use the bathroom or anything like that?
No.
Okay, and do you know where you are today?
Yes, the hospital.
Okay, perfect. And then do you know what year it is?
2025.
Okay, awesome. So my patient is awake, alert, and orientated ×3. So I'm just gonna raise your bed now to a working height. Okay, perfect. And then if you wouldn't mind, if I could just check your scalp really quick.
Yep.
Is it okay if I touch your hair?
Go ahead.
Okay, awesome. So I'm just going to check the head for any lumps, bumps, or lacerations. I don't see any abnormalities, no ridges, anything like that. I don't see any signs of lice or head dandruff. I don't see any kind of bed sores on the back of the neck or anything like that. Do you have any discomfort when I apply pressure?
No.
Okay, awesome. So I am going to change my gloves now, and I'm going to perform hand hygiene. I'm going to don a new pair of gloves. Get started with the rest of the physical assessment. Okay, so now we are going to, I'm going to ask you to close your eyes. Okay, I'm going to grab something for you to smell,
Okay.
and then you just let me know what it smells like, okay?
Okay.
Okay, could you go ahead and smell that for me?
Alcohol.
Okay, perfect. And then you can go ahead and open your eyes. And then I'm going to assess your nostrils with my pen light. Okay, if you could just tilt your head up slightly for me. Okay, I don't see any signs of drainage or blood, so it looks good to me. And then I am just going to touch your face if that's okay. All right, do you have any tenderness, any discomfort?
No.
Okay, awesome. Have you had any fractures or nose jobs, anything like that?
No.
Okay, any sinus problems?
No.
Okay, so I'm going to ask you to breathe in and out for me. Okay, perfect. So now I'm going to ask you to close one side of your nostril. Can you breathe in and out for me again? Okay, awesome. Can you do the other side? Okay, perfect. So that looks good to me. And so it looks like cranial nerve number 1 olfactory is intact. Okay. So now I'm going to assess your eyes. Both eyes look to be the same size, equally as dilated right now. And the sclera is white. Could you just go ahead and pull on your eyes for me? Okay, conjunctiva is pink and moist, beautiful. And then the pupil size looks to be about a 6.
Okay.
Okay, perfect. So now I'm going to, do you wear any glasses?
No.
Contacts?
No.
Okay, so I'm going to ask you to read my badge for me.
Okay. Broward College.
Okay, and then could you go ahead and read that for me?
Group study.
Okay, awesome. Actually, could you read that for me one more time?
Group study.
Okay, perfect. The pupils do dilate when the patient is looking far away. I am now going to shine my light into your eyes. Okay, I'm going to do this one first. I'm going to do this one, and I'm going to do them together. Okay. Okay. Dilated. Okay. And both eyes dilate bilaterally. Okay. Perfect. So constriction is brisk, consensual, and you have parallel reactions. Okay, so now I'm going to just test for convergence. I'm going to hold my pen light over here, and without moving your head, I just want you to follow it. I'm going to bring it close to your eyes, okay? Okay, and both eyes do convert bilaterally. So now we're going to test your 6 cardinal fields. I'm going to need you to follow my pen with your eyes, okay, without moving your head. I'm going to point it up, to the side, and down for both eyes, okay? Okay. Ocular motor is intact, ocular motor is intact. And then abducens is intact, ocular motor left is intact. Okay. Trochlear is intact, ocular motor left side is intact. Okay. Ocular motor intact. Abducens intact, right ocular intact. And then trochlear intact, right ocular intact. Thank you. Okay, so cranial nerves, number 2, optic, number 3, ocular motor, and number 4, trochlear, and 6, abducens are all intact. Now I'm going to inspect your face. I don't see, upon inspection, any lumps or lesions. Eyebrows are symmetrical, eyelashes, the color looks good. Okay. So I'm just going to touch on your forehead and see if anything hurts, okay? So let me know if you feel any pressure or discomfort.
No.
No, everything's okay?
Yes.
Okay, and then I'm just gonna touch right here between your jaws and can you open your mouth for me? Okay, everything's normal. Beautiful. And then I'm gonna ask you to close your eyes. And then I'm just gonna see you tell me where I'm touching you, okay?
Forehead.
Okay.
Cheek. Nose. Chin. Cheek.
Okay, perfect. Do you have any trouble with chewing?
No.
Okay, and then I need you to puff your cheeks for me. Give me a big smile. Raise your eyebrows. Okay, perfect. So cranial nerve number 5, trigeminal, and cranial nerve number 7, facial, are intact. Okay, test your ears. Upon inspection, they look to be symmetrical. I don't see any excess straining on the outside. So I'm just gonna shine my pen light into your ears if that's okay.
Yeah.
All right. So I don't see any excess serum on the inside, nor do I see any bleeding. I'm just gonna come around and check the other side.
Okay.
Okay. And on the right side, I also don't see any excess serum or bleeding. Everything looks to be okay. Do you use any hearing aids?
No, I don't.
Do you have any difficulty hearing?
No.
Okay, awesome. So now I'm just gonna ask you to cover up one side of your ear. I'm gonna come around here and I'm just gonna whisper, okay? And you're gonna repeat the word back to me.
Okay. Blueberry.
Okay, can you cover the other side for me? I'm just gonna come around. Okay.
Strawberry.
Okay, beautiful. So cranial nerve number 8, acoustic, is intact. So now I'm just going to examine the inside of your mouth. Can you just open wide for me? Okay, hard palate looks to be intact. Tongue looks pink and moist. Soft palate is okay. I don't see any signs of cavities or inflamed gums. Go ahead and smile for me. Okay, yes, no inflamed gums or excess bleeding. Okay, can you say ah and then swallow for me? Okay, perfect. And then I'm gonna have you swallow again. Say hi.
Hi.
Okay, perfect. And then I'm gonna need you to stick out your tongue for me. Okay, and then I'm gonna need you to move it side to side, up and down. Okay, so cranial nerve number 9, glossopharyngeal, cranial nerve number 10, vagus, and cranial nerve number 12, hypoglossal, are intact. Now I'm just gonna assess your shoulders. Do you have any shoulder pain or discomfort?
No.
Okay, so I'm going to put my hands on your shoulders, and then I'm just gonna ask you to shrug up against me, okay? Alright, go ahead. Okay, strength seems to be normal. I'm gonna place my hands on either side of your face, and you're just gonna push against me, okay? Alright, beautiful. And then right here. Okay, strength seems perfect. And then we're gonna just check your range of motion. So if you could put your head straight for me, that's gonna be the midline. And then I'm going to have you hyperextend, look up to the ceiling for me. Okay, come back to midline. I'm gonna have you look to your chest, reflection. Can you put your ear to your left shoulder? Okay, perfect, and then ear to the right shoulder. Okay, and then can you do a circular motion with your neck? Okay, perfect. And then can you roll from one side to the other? Okay, perfect. So cranial nerve number 11, spinal accessory, is intact. Let me go ahead and inspect your neck. Is it okay again if I touch you?
Yes.
Okay, upon inspection, I don't see any lumps, bumps, or lesions. And with palpation, I also don't see any lumps, bumps, or lesions. Do you have any tenderness or pain when I touch your neck?
No.
Okay, perfect. So typically, if I could lay the patient down, we'd be checking for jugular vein distension. Can't lay my patient down, but I don't see any protruding jugular from where she is right now. So we're just gonna keep going. Okay, so now I'm just gonna check your carotid on both sides.
Yeah.
Okay. Okay, pulse is strong. And pulse is strong. They are moving bilaterally, +2 and normal. And then I am going to listen to them really quick. I'm gonna ask you when I start to hold your breath, and then I'm just going to touch on it, okay?
Okay.
All right. Okay, just gonna make sure this isn't too cold for you.
Thank you.
Okay, go ahead and turn your neck for me, and then hold your breath for me, okay? Okay, not hearing any signs of a brood. I'm gonna check the other side. Okay, perfect. And then the tracheal is midline, okay? Okay, all right, perfect. So the neck is perfect and intact. I'm just gonna check your thoracic area, check on your breathing, okay? So first, I'm just gonna give you a small pinch. I just wanna make sure your skin's elastic. Okay, turgor is okay and firm. going to listen to your lungs now, okay? So I'm gonna ask you to take deep breaths in through your nose and out through your mouth, okay? Okay, so at the trachea, we're gonna listen to the bronchodesmolar sounds. Perfect, and at the clavicle line, we're gonna listen to the vesicular sounds. Go ahead. And then now we're going to come down and listen to the bronchovascular sounds. Thank you. Okay, take another deep breath for me. Okay. And your bronchial vascular sounds are equal. Okay, so now I'm just going to ask you to sit up for me, and I'm going to listen to the breathing in your back, okay? So if you could turn for me. Okay, I'm going to listen to the vascular sounds at your mid exhale. Okay, go ahead and take a deep breath for me. Okay, and then I'm going to come around the other side and do the same. Okay. And then I'm just going to check on your back. While I'm back here, I don't see any lumps, bumps, or lesions. Okay, and then take a deep breath for me. Okay, another deep breath. Okay. Take a deep breath for me. Okay, and then another deep breath. Okay, perfect. And then I'm going to ask you to still be sitting straight. I'm going to place my hands in the center of your back just to make sure that your chest is expanding properly, okay? Sit forward a little bit. Okay, go ahead. Okay, alright. So expansion is equal and bilateral. And then I'm just going to check your anterior chest and compare, okay? Like this. Okay, perfect. And it is less than 1/2 of the anterior chest. Okay. Do you do a routine breast exam monthly?
Yes, I do.
Okay, perfect. Okay, so the thoracic cavity looks good and intact. So now I'm going to check your abdomen. Typically speaking, we would have the patient lay flat for this, but given the circumstances, we can't, so we're just going to go ahead and continue with the exam. Okay, so upon inspection, I don't see any lumps, bumps, or lesions. I don't see any stretch marks, no distended abdomen. Do you have any issues with appetite?
No.
Pain, nausea?
No.
Do you have any issues with your bowel movements?
No.
Okay, so I'm just going to go ahead and listen to your abdominal aorta really quick.
Okay.
And then I'm going to go through and listen to the quadrants of your stomach.
Okay.
While listening to the quadrants of her stomach, I would typically listen for 1 minute in each quadrant, checking to 5 to 35 vowel sounds. If there were no vowel sounds present in that minute, we would go through and listen to them for 5 minutes. Okay. So we would check here for your aortic sound. And then we would go from bottom right to listen to the vowel sound. So right here for a full minute. We would come up to the upper right for a full minute. Then we go upper left for a full minute. And then lower left quadrant for a full minute. Okay, I'm gonna go ahead and palpate. Just let me know if you have any discomfort, okay? So, okay. Any discomfort where I'm pressing? No? Okay. Alright, so everything looks good. Okay, so now typically we would perform a vaginal exam. We're not going to be doing that in today's assessment, but I would be checking for lumps, bumps, and lesions, any discharge, any swelling, any foul odors. I would be checking I would be inspecting her labia and her vaginal orifice. When was your last menstrual period?
January 1st.
Okay, perfect. Okay, how was that?
Good.
Okay. Do I sound? I feel like I slept.
I was literally thinking how incredible you are.
You were so nice. You should have seen me yesterday. I think I'm still just traumatized.
I think that you need to watch my video because I missed like half the things that you did. I didn't even mention the vaginal orifice. Then again, I did it on a boy.
That's good. You know, all things considered, I think that's okay. Okay. Girl, because yesterday I slept so bad. I'm gonna show you the part of the video. Okay. Okay, so now we're gonna check your upper extremities. I'm just gonna assess your arms. Upon inspection, I don't see any lumps, bumps, lesions, or lacerations. Everything looks good. Color looks good. And then hair seems evenly distributed. I don't see any moles and no signs of edema. And I'm just gonna check the capillary refill. Okay, it's strong +2. It does refill. It's brisk within under 2 seconds. And then I am going to check your radial and brachial pulse. Just gonna come and check over here. Okay, that would be strong N +2 at the radial pulse site. That would also be a +2. I'm gonna check on this arm as well just to make sure they're bilateral. Okay, +2 and +2. Okay, and then I'm just going to have you wiggle your fingers. Okay, perfect. And then if you could close your eyes, I'm gonna touch on your arm, and you're just gonna let me know on both sides where I'm touching. Okay.
Left hand. Left forearm. Left bicep. Right bicep. Right hand. Right forearm.
Okay, perfect. So it seems that she has all her sensations intact on both sides. Okay, so now I'm gonna check your range of motion. So I'm going to have you put your hands out this way. This would be pronation. We're gonna flip to supination. We're gonna flex them. We're gonna extend them. We are going to abduct them and then adduct them. Okay, perfect. So range of motion is good. And then we're just gonna assess your strength. So I want you to pull on my fingers for me, squeeze as hard as you can. Okay, awesome. And then if you could lay your hands out again. Okay, go ahead and push out for me. Go ahead and push down for me. Okay, push out. And then push in. Okay, perfect. Okay, so the patient's strength is good. It seems like her upper extremities are intact. Okay, so now I'm just gonna do the lower extremities, the legs and the toes and the feet. So upon inspection, I don't see any abnormal discoloration. Hair growth looks normal. Legs look symmetrical, feet look symmetrical. I don't see any redness, lumps, bumps, or lesions. Looks good. Do you have any difficulty walking? Okay, and then, alright, so I'm just gonna palpitate really quick. I'm gonna get some pressure. You let me know if there's any discomfort.
Okay, that's fine.
Okay, knees are good. Okay, and feet.
Yes.
Oh, perfect. So, and upon looking at the toenails, I don't see any signs of fungus or infection. Everything looks good. So I'm just gonna palpitate your popliteal pulse, okay? Okay. Everything looks normal. They're pulsating bilaterally. I'm going to check your posterior tibial pulse.
Okay.
Okay, they're also pulsating bilaterally. And then I would palpitate your dorsalis pedis on top of the foot and check to see that it is 2+. Okay, I would also be checking the capillary refill on the toes. Okay, and then if you could just push your feet against my hands.
Okay.
Okay, and then go ahead for me.
Okay.
Okay, and then if you could lift your legs against my hands for me. Okay, so strength seems good in the legs, and the lower extremities seem to be intact. Alright, so we're all done with your assessment. I'm just going to bring your bed back down. Lower your bed. Okay, I'm going to place one guardrail up for safety. Okay, I'm just going to perform hand hygiene. I'm going to discard my gloves and perform hand hygiene again for 20 seconds. Okay, I'm going to give you your call light. I'm going to place it right here. Okay.
Thank you.
And then right here, we're going to move over your phone and your water. Okay, and then is there anything else I can help you with before I go?
That's all.
Okay,
Thank you.